Hello everyone, welcome to eMedSchool, your virtual medical school. Today in this video we are going to discuss on what is fever and what are the different patterns of fever. There is diurnal variation in temperature, that's why we need to consider that thing. So any temperature that is more than 98.9 degree Fahrenheit in the early morning and or more than 99.9 degree Fahrenheit in late afternoon or evening is considered as fever. But for clinical simplification, we consider fever if the temperature is more than 99.9 degree Fahrenheit, regardless of the time of the day, right? So first one is remittent fever. In this kind of fever, the variation in temperature is like the temperature goes up and down, but the fluctuation in temperature is more than 1 degree Celsius and it doesn't touch the baseline. And the examples of remittent fever include typhoid, infective endocarditis, sepsis, connective tissue disorders like SLE, rheumatoid arthritis, or leukemia, lymphoma. One thing to remember here is that the fluctuation in temperature is more than 1 degree Celsius and it doesn't touch the baseline. Another important thing here is one disease can have different pattern of fever, like sepsis I mentioned it here in remittent fever, but sometimes it can also cause continuous fever, so nothing to get confused with it. So that's all about remittent fever. Now let's move on into another one. In intermittent fever, the temperature variation or the fluctuation in temperature is again more than 1 degree Celsius and it touches the baseline in between the temperature. So in 24-hour duration, the temperature touches the baseline and the variation in between temperature is more than 1 degree Celsius. The examples of intermittent fever include malaria, sepsis, visceral leishmaniasis. Third one, the continuous fever. In this type of fever, during the course of 24 hours, the temperature is the sustained rise in temperature, also known as sustained fever. The difference of fluctuation in temperature is less than 1 degree Celsius, which differentiates it from recurrent fever. So the temperature difference is less than 1 degree Celsius and it never touches the baseline. So this is continuous fever. The example of continuous fever include typhus, pneumonia, visceral leishmaniasis. Now in biphasic fever, so there is distinct phases when their temperature is elevated and in another phase the temperature is in the baseline. So over the course of days, the temperature, there is cyclic variation in the temperature, sometimes getting high up and sometimes getting to the normal range. This is also known as saddleback fever because it looks like the saddle of the horse, so saddleback fever. And the examples include dengue, yellow fever, and leptospirosis. Another one, the undulant fever. In this kind of fever, the variation in temperature is quite wavy. So there's wavy variation in the temperature. The temperature remains high for some duration of time and again it goes down. But unlike a biphasic fever that we just discussed, the variation is not cyclic, rather it's quite irregular, giving its wavy pattern. And it is typical in case of brucellosis. Now we are talking about another kind of fever in which there is increased temperature or febrile period for around 1 week or so, and then again a febrile period for a similar duration, and again the fever goes high up, and this kind of pattern in which there is febrile period for 1 week, 2 week, then again a febrile period for similar duration, then again fever. This is what we call as pale abstinent fever, and this is typical of Hodgkin lymphoma. This is not specific but quite commonly associated with Hodgkin lymphoma. So this brings us to the end of the video. Thank you for watching. I hope this video was helpful. If you think this video was helpful, make sure you give it a like, share, and don't forget to subscribe.